Hello, welcome to Unfrazzle TV. My name's Emma Leivesley. I'm the woman that unfrazzles doctors, wellbeing and burnout coach for healthcare professionals. And I am joined today by Dr. Lewis Thomas, who is coming from Manchester today. And he's an ex-GP who is now working as a peak performance coach for people with sickle cell. So, hello, Lewis.
Hi,
Welcome on
Emma.
today. So I've given a bit of an introduction. Do you want to give
Yeah,
everyone a little bit more information about where, like, your career trajectory and how you've ended up doing what you're doing?
yeah. So I'll try and keep it succinct because it's been a bit of a long journey. But like, feel free to ask me like any follow-up questions. So yeah, I qualified as a GP in 2019. I was immediately kind of like, this doesn't really feel like it's going to be something I can sustain for the rest of my career. In terms of, I guess, just getting a bit frustrated with the system and not having that sense of freedom to practice medicine the way I wanted to do, that actually helps people, and the way that I've been trained to because of lack of resources. And then also, I obviously have sickle cell anemia, which is something that's been with me my whole life, and really kind of directed the trajectory of decisions that I've made. Being a healthcare worker and having sickle cell was basically more of a push towards what am I going to be doing long term, like the stress that goes with this job is something that I realized was really kind of affecting my sickle cell. So I decided that I needed to find something else. I went into life coaching initially because I was really interested in personal development. So yeah, long story short, I started a coaching business. I sort of semi-left GP because I was locuming anyway, so it was kind of like in and out. Um, and along the way, I think I ended up in hospital with a sickle cell crisis, and I met. It kind of reminded me of sickle cell and of just that chronic health condition that was always going to be there. But also it gave me the opportunity to speak to another sickle cell patient that I encountered in clinic, in the follow-up clinic. And I just realized how much experience and knowledge I had, having been a medical doctor, and it was all stuff that I took for granted. And with the personal development coaching that I'd done, I was in a perfect position really to do something that really helped the sickle cell community and helped people facing challenges to overcome them and succeed. And both from like a medical perspective, because there's just so much medical knowledge that is really helpful for a condition like sickle cell, which is poorly understood by most healthcare professionals. And patients have to work really hard to advocate for themselves. So there was that aspect, and then there was the aspect of, like trying to get people to reach goals and aim high and not, kind of succumb to stereotypes and negative conditioning. So yeah, it's been a wild ride, sort of following my interest and values and doing what feels right. And at the moment, what I'm doing is creating educational sickle cell content primarily to help people understand sickle cell and really advocate for themselves. my plan currently is to create a sickle cell community which has educational resources that I've made, and have that free and available to anyone who needs it. So that's what I'm going to be working on for the first part of next year, hopefully if we can get the funding for it.
And I think that's really important, because I don't know much about sickle cell. I've learned a lot from reading your posts. And I think because this podcast is listened to by healthcare professionals, every single healthcare professional will at some point be treating somebody with sickle cell. But not only that, a lot of people working in healthcare do have the condition too.
Yeah.
How would you say that sickle cell impacted on your role as a healthcare provider?
So there's several aspects. I think the main one, is probably what got me into medicine in the first place. So having been a patient myself, especially having experienced very severe pain that very few people can understand because it's invisible, that gave me this sense of empathy and compassion for other people suffering, particularly from invisible pain. So it meant that I was always going to be very sensitive to suffering and really sort of want to go the extra mile to make sure people who were hurting got the right care. Because, I knew what it was like to be in that place and to be in pain and to be ignored or be misunderstood. So I never wanted anyone to have to experience that under my care. So I would say that made things probably a lot more stressful for me because the resources weren't available to allow me to provide that care without burning myself out. So burnout, is pretty common in all healthcare professionals. But then I think when you have something like sickle cell, which can be triggered by chronic stress, it's even worse. So it just kind of like crept up on me, I think, without me realizing, because I'd been I was like 23 when I started working as an F1. So like I had actually been more or less okay throughout medical school, maybe had like 1 or 2 sickle cell crises a year. And it was manageable. But now when I was started working as a doctor, it was like if I got taken out by a sickle cell crisis, who's there to look after all these patients? There's no one that can fill the rota gaps because there's no it was always short staffed. It was always this pressure to just be well and be there for other people that are needing support. And it took a while for me to kind of realize that it wasn't fully my responsibility, and to realize that I have to put myself first. So I think having sickle cell, it kind of it made me feel really strongly that I had to take care of everyone else, but then ended up sort of ignoring myself, because I felt like I have to make sure everyone else is okay. And then, it just ended up with a series of hospitalizations and crisis and pain, which was like the wake-up call for me to realize, okay, something needs to change, basically, because it's either the system changes or you have to change. So I didn't think that the system was going to change. and speaking to everyone else, you're kind of pressured into feeling like you have to be able to cope as well, because they're all coping, and everyone else is just soldiering on. And it's just that kind of culture of, don't complain, it's a great job, you're privileged, you're helping people. So you just kind of like push it to the side. And I think when you have something like sickle cell, which for me, the way that it affects me is it's kind of like these acute, sudden episodes that can come up out of nowhere unexpectedly. And then in between, it's just life as normal. So it's kind of like, oh, I'm just a normal person. I'm, soldiering through all these stress and terrible conditions like everyone else is. And I'm trying my best to avoid triggers for sickle cell crisis, like dehydration and, overexhaustion. But it felt like I was always putting that second to showing up for patients and being able to, appear as though I was the same as everyone else when I wasn't.
Yeah. And I think that's really important. It's important for all doctors to look after themselves. And there is that risk of push, like everybody else, and all the guilt that comes with that. But if you've got a chronic condition, it's vital that you do get rest and not push it. And with the hydration thing, having worked in healthcare myself, it's so easy to become dehydrated working in healthcare. And I think it's sad that the thing that made you so empathetic was what led you to leaving, because of how you were pushed. And it is a systemic thing as well.
Yeah. And I often think about that, because especially the more that I've spoken to like different kinds of doctors, it's really sad when any naturally empathetic doctor is, forced to leave or like burnt out, because they're the ones that you actually want treating patients, like treating your friends and family. But the system is just, it's kind of not built for that kind of care in a way that's sustainable. So yeah, I think possibly like if I didn't have sickle cell, I probably would have still been fairly sensitive and naturally empathetic anyway. But if I didn't have sickle cell, I might have just continued and continued to be a doctor, and I think just been unhappy because of not being able to practice medicine the way that I wanted to. So yeah, I think it was kind of like a good thing. Like sickle cell got me out, but then got me into medicine, but then it also got me out of medicine, and it kind of took me on this path where I had no choice but to sort of figure out a different way to use the same skills and training in a more healthier kind of system that I had more control over.
Yeah. And I think from reading news reports, a lot of GPs are thinking of leaving at the moment.
Yeah.
There's going to be a mass exodus. That's what's predicted.
Yeah. So that 1 in 3 GPs in the next 5 years are gonna quit. But yeah, reading stuff like that now is, I don't know, it makes me feel kind of validated in a way. I think it's sad for the NHS. But I think for me, knowing that if I don't know what those 1 in 3 GPs have going on in their personal lives, what if any of them have, like chronic health conditions like I do, then it just makes you think it's clearly not a sustainable life
Mm.
for anyone, never mind people with chronic health conditions.
Mm. Yeah, and as you say, it's that not being able to provide the care and having that moral injury because you've got shorter appointments. The workload is just getting worse and worse. It's not being able to have the time to holistically treat a patient as well. It's kind of like you really rushed. I think that's playing a big part.
Yeah, and it is that moral injury that makes you feel like, oh, why am I making these decisions? And it's that awareness. Particularly, I remember like being a GP and just being conscious of the choices that I was making during consultations, of being like, I just have to provide something that is good enough to not get referred, not get a complaint, not get referred to coroner. Like that's all I care about, because it's just kind of like survival. So I'm making decisions through that lens rather than making decisions about what is actually in the best interest of this patient in front of me, and having the time to provide those kind of explanations about management, and really sort of getting beneath getting to the root cause of the problem, so that it doesn't come up again and just go round in circles. That was the most frustrating thing that I think really killed me in GP, just feeling like I wasn't having any actual positive change, because I was just seeing the same people, even when it was like different people. In your mind, when you're working so much, you're doing so many consultations, different people coming in with the same story, it kind of makes you feel like you're just seeing the same person over and over again. I don't know. I don't know if anyone else like has that, but there were like some runs when I was working quite a lot when it would just be the same thing over and over again, and I felt like I was just stuck in a loop, just saying the same sort of management explanations and diagnosis, going through the same motions. Yeah, and I think that's what really sort of burnt me out the most. Just not having that win, that sense of, oh, I've actually done something, I've made a difference, I've changed someone's life, even if it's something like small. But then again, it is up and down. You have good days, you have bad days. I feel like I feel like I'm being really negative. But yeah, it's that's the experience that I had.
So we've talked about what it's like being a professional with sickle cell. What's it like being a patient with sickle cell?
Well, I guess the experience that I've had is kind of like in two separate parts. So there was like the experience I had when I was like 18 to 23, sort of young medical student, and then the experience I've had when I was a doctor. So I think that the worst experience is like the 18-year-old experience that I had, because that is when you're going through the transition from pediatric to adult care. And the thing about sickle cell is that historically, obviously, their life expectancy has been really low, because there haven't been any treatments. So pediatric care for sickle cell is really good, because it was only, you know, a disease of childhood, really. And as treatments have come in with and better, you know, better technology and more advanced treatments, people have been able to live longer, and have progressed into adulthood and adult care, but adult services have not kept up. So you get into this situation where it's just a complete shock. So you've been going in and getting, you know, decent pain relief for being treated as a child, and you've got your parents there, and you've got, you know, all this kind of good, positive support, and then you turn 18, and I remember having my first sickle cell crisis and going to the hospital as an adult, and they just see you as a stereotype. Just you're just a black man asking for morphine who looks completely comfortable and not in any physical pain. And it's just a horrible emotional kind of traumatic experience to go through, because you have the physical pain, but then you have that judgment. You have people associating you with negative stereotypes, and not only do they not believe that you're in pain, but they, you know, actively feel like you are there trying to get one over on them, trying to get a fix. And it's just really, it's just really not nice. It's not an experience that I'd want anyone to go through. And it really is like the biggest issue with sickle cell care, because it's a complete lack of education in medical school and you know, training for healthcare staff. People don't know enough about sickle cell, and when that happens, they just revert to the conditioned racial stereotypes that they have. Yeah, it's very hurtful, and it's very psychologically traumatic to go through that. And there are, I think what bugs me the most is that I have like medical knowledge, so I know, you know, how to ask for things. I know what should be happening, and I'm able to articulate that and like stay calm, and sort of handle these conflicts. I'm obviously not talking about like all healthcare professionals, but the fact that you're having it with any healthcare professional at all is not right. But there are people that just have no idea how to handle these situations, and really end up suffering because of it, because they don't have the they don't have the knowledge that they need in order to actually advocate for themselves and to get treated fairly and get treated right. So yeah, I think that's what it's like being a sickle cell patient. You constantly are made to feel like a fraud, even though you're experiencing pain that's like more severe than anything anyone could ever imagine. When I was 12, I had my first sickle cell crisis. I wrote about this in my book. But the pain was literally so bad, and it was the first time that I was experiencing it, that I think I thought I was going to die, because I couldn't understand how it was possible for this kind of pain to be something that someone could survive and live with. So I thought I was going to die, and like that was it. That would have been I'm good. Like, I'm happy to, if I don't have to have this pain, I'm happy to not be alive, because that's how bad it is. And like, when you're in that level of pain, you can't be dealing with people who are making snarky comments, or like, oh, you don't look like you're in pain, or oh, your bloods look fine, and just kind of throwing all this ignorance at you. It's really a lot, and you develop a lot of strength, a lot of mental strength. I think as someone living with sickle cell, and I don't even have crises that frequently. It's only like once or twice every couple of years. Some people have to go through that, monthly. And yeah, it's something that really needs to be. It really needs to be a bigger part of the training and education for healthcare staff, because it's like I said, that experience of pain was what made me want to go into medicine. So I think no one deserves to. We need to do everything that we can so that no one has to suffer like this. And that's where I'm at now. Like, that's why I'm so happy that I'm on this path where I'm creating this service, and being part of the change that is going to help people with sickle cell, going to help people not have to experience some of this pain.
Yeah, and I think as you say, you've got that medical background. It must be absolutely terrifying for somebody who hasn't. Because I remember when you came on my Team Healthcare podcast and we were talking about how when you had to move away from your support network and you had a crisis, and that sort of detachment and not having people around you. I think if somebody's on their own and they haven't got that knowledge, it's going to be very difficult. So, yeah, I think it's amazing to have that education for people so that people can advocate for themselves.
And I think people need, like, it's not ideal to be alone when you need someone to advocate for you to an extent as well, because it requires a lot of energy when you're in a very vulnerable position where you just don't have anything to give, and you're being asked questions, and just answering is like vital energy that you're trying to conserve. So I think if we can get to a position where we don't have to, work so hard to just get what we need, like, it's very simple. Like, all it is a matter of treating pain. Doctors are capable of doing this, and I don't think it requires that many additional resources. It's just changing beliefs and changing, the conditioning, and just helping people get with the program and like come into like the present and get out of the past. Yeah, there's a lot. Like, it's very painful as a sickle cell patient, from multiple angles, and it's why I'm so passionate about it. Even though, for the majority of the time, I'm quite well. I'd say, like, on the spectrum, particularly now I'm speaking to so many people with sickle cell, I definitely feel like I'm lower down the spectrum, more towards mild. But I think just having experienced the same pain level, even if it's only like, you know, less frequently. I just know, and I just have this connection with people that's very difficult to that I've not felt with any other patients really. Well, not many other patients. And it just feels like this is what I'm supposed to do. So yeah.
Yeah. And it is vital because people are struggling. And I was actually really, really shocked to read some of your posts about how you've been treated. But not only that, from the comments, it was like, this isn't an isolated incident. A lot of people have experienced this too. I think getting staff to change their attitude is a big thing that needs to happen. I mean, with chronic pain anyway, I think attitudes and prejudice are rife amongst healthcare professionals. But then you've got the added institutionalized racism as well, that comes with sickle cell. So when you are doing your coaching, what do you do? What kind of things do you look at? How do you help people?
So the coaching has changed from what I was initially doing. What I was initially doing was kind of helping people outside of the sort of acute sickle cell crisis, you know, in their day-to-day life, helping them to function better, because I think a lot of the problems with sort of daily living with sickle cell are related to work and stress from work and working in environments that are triggering for sickle cell crisis and pain, and kind of dealing with the lack of understanding from employers and HR, and having meetings and things like that for time off. So a lot of it was just kind of helping people to figure out a plan of how to tackle those specific challenges that they were facing, in terms of, you know, trying to improve their health and their work, and sort of find better work, which was healthier for them, and also just, I guess, address the mental health aspect of it. Obviously, like, I'm not a trained psychotherapist, but because I have that lived experience of having, you know, the same sort of thoughts that people might be having, and, you know, facing the same stigma and prejudice, it's like I create a space to sort of talk about those issues, and you know, allow people, I think, to just open up and talk about the psychological and mental strain of various different aspects of life with sickle cell that you just can't really talk about with someone who hasn't experienced it. You know, one of the issues that I sort of find really powerful to talk about is how a lot of people with sickle cell are told from a young age that they're not going to live long. You know, that their life expectancy is they're not going to live past 18 or whatever. So they live their whole life based on that belief, and get to the age of, you know, get into their mid-20s and have this kind of quarter life crisis because they don't know what to do. So it's just helping people through that, helping through just various life choices and transitions, and just living life healthily with sickle cell. What I'm what I want to focus on now is kind of like lifestyle management and long-term care, so that people are able to be as healthy as they can possibly be with sickle cell, both physically and mentally. And then that's obviously giving them the education and knowledge that they need to take care of themselves, and then helping them implement better habits and routines, and I think just also helping them feel more confident about talking about sickle cell. Because if you don't about talking about sickle cell and about accepting that they have it, because if you don't accept it, then you won't change the damaging habits and behaviors that are triggering sickle cell crisis, because we all go through, you know, that phase where we just want to be normal, just want to be like everyone else. And in trying to do that, you end up damaging yourself, because you have sickle cell and it's always gonna be there. And the only way to really like help yourself is to accept that it's there and start to do things your own way. And this is why I think it's so good, you know, when people are in the comment section of my posts and they're sharing their experience, because it's a lot easier when you know, oh, actually, I'm not the only one. Other people are going through this as well. Other people have experienced this as well. I'm not weird. It's just that I have sickle cell. So I think it's giving people that community, which is the direction that I'm going, which is what I'm trying to build and create right now.
Yeah, definitely. I think community is helpful with any kind of problem, but certainly for something so misunderstood. I think it's important.
Yeah, I think it's really important that you are around people that understand you, or just around people that you can feel safe to express your true experience. And I feel that in relates to anything really. Like even when I was sort of transitioning out of medicine, and I felt like really self-conscious about, oh my God, made a huge mistake. What are you doing? Like you've invested all this stuff. It felt a lot easier speaking to people that had done the same thing and had the same experiences. So there's definitely comfort in community, and I think with something like sickle cell, it's kind of like a safe, protected space for people that are having to deal with systems that are just completely lack knowledge, and they are suffering because of it. So we can all educate each other. Like people share stories, and sometimes people share stuff that I don't even know about, that I've never come across before. So everyone's just learning together, really. It's great.
Yeah, and it as well with something like that. It's not just the physical aspects; it's what it's doing to you psychologically. As you've mentioned, you've got the way that you're treated, and a big one that you mentioned is being told that you're not going to have a long life. That must be absolutely awful to have that being told this from an early age. Like I can't imagine how that would impact on somebody. I'd imagine it'd create a lot of anxiety and also hopelessness.
Yeah, I mean, it's something that like I think I've came to terms with but also like I had quite a good hematology team, so they kind of like updated me as I grew up, like you're actually going to be fine, like no one's so I didn't personally have to experience that, but I've heard from a lot of people who have. And you know, some people will kind of just take risks because you know what I mean, like dangerous risk, because they're just like it doesn't matter, you know, I'm not going to be around for long, so just live fast, die young. And I think that's where people get into trouble, because it's then very hard to change when you spent so long with that belief, and you've made decisions you know based on that. And then the other thing I wanted to mention as well, because you asked about like what it's like being a sickle cell patient, there's a lot of cultural differences between like me being born and raised in UK and someone that might have been born and raised in Nigeria, for instance, that has the highest population of sickle cell. So in a lot of African countries, the culture of sickle cell is, you know, that it's like demon, witchcraft, curses, you know, all these kind of myths that have been created to explain the events that happen to sickle cell, people with sickle cell. And those beliefs are still present, so people are still having to like grow up with those, and that kind of stigma means that people are generally treated as second-class citizens. They don't want people to find out that they have sickle cell, because it will mean that they're treated differently. They're not going to get jobs. They're going to be passed over for jobs, not be able to get a job and get a relationship. And one of the things that I get asked about most regularly is how to get rid of yellow eyes. So that's one of the main concerns that people living with sickle cell have, because if you're having a fast rate of breakdown of the red blood cells, it causes raising bilirubin levels, which creates jaundice and yellow eyes. And it's like an instant indicator that you have sickle cell, there's something wrong with you. So I really like it, and again, it's like it's not something that you can really do anything about either. A lot of people want this kind of drug or medicine that's going to fix the yellow eyes so that they can go into hiding and not be, you know, sort of pass for normal. And I'm trying to get people to really sort of get to that place of acceptance, because there isn't, otherwise they're just vulnerable to scams and, you know, all sorts of things that people promote as getting rid of yellow eyes and this and that. So yeah, I think I'm trying to change the narrative of sickle cell, the way that it's viewed, so that it's not so stigmatized, and it's not, you know, associated with so much negativity. You know, children in schools being called lazy and stupid because they're anemic and they're fatigued and they have brain fog because of the sickle cell, and they can't concentrate or stay awake in class, or they're missing loads of school because they're having to, you know, be in hospital, and they're not getting to the same academic level as their peers. There's all sorts of negative sort of associations and stereotypes. And one of the things that I had commented on a few months ago when I started talking about sickle cell was how there are lots of successful people that are living with sickle cell as well, but you wouldn't know that because they don't talk about it, because they're afraid to talk about it, because there's so many negative associations with it. And I've learned that it helps people. People have said to me, like, you know, I'm so happy to learn that I know you're a doctor with sickle cell. Like, I've never met a doctor that has sickle cell before. And I feel like it's something that I'd taken for granted in terms of being a role model for younger sickle cell warriors and kids that, you know, might aspire to be a doctor if they want to be. Obviously, the way I'm talking about being a doctor this evening doesn't really make it in a positive light, but you know, if that's their choice, they have the ability to do that as well. It's just about getting people the right support and giving them the belief that it's possible. Yeah.
So I suppose, especially if people have got that idea that it's a very limiting illness and there's that low life expectancy, to have somebody in front of them that's done something like trained to be a doctor, it kind of opens up doors.
Yeah. It's all about the power of belief and, you know, your mind, in terms of seeing that it's the way you see the world. If you know that it's possible to become a doctor or become a lawyer or whatever it is that you want to do, because you can see that someone else has already done it, that has sickle cell, it means that you're going to see more opportunities to sort of navigate around the challenges that sickle cell poses without giving up. Because I think if you have sickle cell and you might aspire, you know, to be a doctor, but you're coming up against obstacles like you're getting ill too much, or you're hospitalized, or you're behind on work, you can either give up and say, oh, okay, I'm just going to believe that it's not possible for people with sickle cell to do anything, or you can find a way around it that works for you. Except I have sickle cell, I have to do this in my own way. I have to, you know, be creative and find a way that works for me. And this is the kind of like coaching that I want to empower people with. So yeah, that is something I've been talking about coaching, but I guess the main issue is I want to make this accessible for people. Obviously, when I was coaching before, initially when I started my coaching business, it was paid. And I went into the sickle cell space because I wanted to help people with sickle cell, but the majority of people with sickle cell don't have the financial resources to invest in coaching. So this is why I've just kind of been like, okay, now that I've started, I'm not just going to be like, okay, I'm going to do some other niche now, because this is meaningful to me. Like, this helping people with sickle cell is something that I need to make happen, and something that I know is an unmet need. So that's why I've been creative in terms of figuring out how to make that work for people, so that they can access the you know, the coaching that and value that I want to provide to people.
Yeah, definitely. And I've always been big on expert by experience. So you've kind of got both of those sides. You've got the expert by knowledge and expertise in your previous work, but also the lived experience too. And I think that's like a very powerful combination.
Yeah. I definitely feel like it's something that's needed, and it's something that doesn't really, like you said, it doesn't feel like work. It just feels like it just feels like something that I'd naturally do, because it doesn't make sense to have all this knowledge and experience and not share it with people who need it and can benefit from it. And I feel like now, because sickle cell has been neglected for so long, we only had like one drug for long-term treatment, hydroxyurea. And it's only in the last few years that the new developments around gene therapy have come about, and you've had a couple of new drugs on the market that haven't unfortunately gone very well, but they're developing them. But because there's been so much neglect, people with sickle cell don't really trust medicine and healthcare systems very much. So this is where someone like me with lived experience of sickle cell, that understands the pain and understands the problems from their point of view, but then also understands medicine and the evidence and research, I can communicate with them. I can connect with them, and there's this kind of inherent trust, because why would I advise anyone on something that would harm them when it be the same thing that would harm me? Like, I'm just trying to I talk to people straight and honestly, and I think that can be really beneficial for people to have that sense of, oh, okay, I don't need to worry about this person, trying to do some nefarious experiment on me, or like be full of, toxins or whatever. If it's good, I will tell you it's good. If it's bad, I'll tell you it's bad. That's it. I like to explain things like very clear and straightforward. I hate complicated stuff. I hate reading like medical textbooks or research studies where it's just in the academic language. I hate it. I force myself to do it so that I can explain it in normal language. But I just wish it didn't have to be like that.
I don't think anybody likes and loves reading academic text, but it's one of those things. If you want a career in anything health related, you've pretty much got to do it.
Yeah, unfortunately. So yeah, I understand it, and it's a necessary evil to, I guess, get the evidence behind things. But yeah, I'm just focusing on like the actual people, and at the end of the day, they're the ones that are going to be choosing whether or not to, use these treatments. And it's all well and good having these, fancy new technological advancements and treatments, but if people don't trust the system enough to actually use them and, engage with them, then it's not going to go anywhere.
Yeah.
And it means that they're missing out on potential treatments that could really improve their health as well.
Definitely. I know that some of the listeners or viewers are coming from a healthcare background that don't have experience or knowledge in sickle cell, but will come across patients with it. What would you say are the three main qualities you would want from a healthcare professional treating you with sickle cell?
So compassion, and empathy, attentiveness. So I think I think there needs to be like an appreciation of it as a medical emergency. And I think just, you know, checking on the pain level and being, you know, responsive to the fact that people might not looking in a lot of pain, but that's just a way of coping with it. And making sure that you just listen and trust what they're saying and believe what they're saying, rather than trying to make assumptions. So just listen. Everyone with sickle cell is different. Just listen to the person in front of you, and also just believe that they would not be there if they weren't in pain. I think that's the thing that frustrates people with sickle cell the most, is when it's assumed that, you know, you're trying to get drugs, or you're drug seeking because you're asking for stronger pain relief, or you're coming in frequently. Like, it's I'm going to go off on a tangent now, but yeah, like compassion, empathy, attentiveness, and trust. Just be a nice person. Just you know, just listen, and don't. I think it's really important to just check for unconscious bias. Because it's not, it doesn't make you a bad person. It doesn't make you a bad person. I just want to make that clear. It's just the way that you've been conditioned. So if you're coming across someone with sickle cell, just believe that they know a whole lot more about the condition than you do. And even if you don't know much about the condition, just treat the pain and then get help, get someone who does know to get involved and advise you.
Yeah. Okay, so for the viewers that are healthcare professionals that do have sickle cell, what advice would you give to them?
So I think it obviously depends on the severity of your sickle cell and whether you feel like you are able to cope with the level of stress that your healthcare job poses. If you feel like it's something that in 10 years' time you're not going to be able to continue doing, then I would advise that you start thinking of alternative ways to provide the service that you want to provide, or do the kind of work that you want to do outside of the current system that you're in, or find a way to change the job so that it's more suitable for you. The biggest piece of advice is just accept that you have sickle cell and that you do need to have adjustments, and explore that. Check with occupational health and seek advice about disability and the benefits that you're entitled to as well. So that would be my advice to healthcare workers in sickle cell, and just look after yourself, because if you don't look after yourself, then you're not going to be able to look after anyone else. And that is what I have learned myself. And that's what I think everyone needs to definitely understand.
Yeah, you've learned the hard way so that other people don't have to.
Exactly. Yeah.
Okay. I know that you've got a free ebook out at the moment and have put the link to that in the description. If people want to get in touch with you, what's the best way for them to do that?
So on my on the link tree on my main link, drlewisthomas.com, you can click on the request help from me option, and if you want help with sickle cell, I have a service, an advice and guidance service, where we can chat on WhatsApp, just 15-minute short chat, and then I'll either signpost you to helpful information or just resolve the issue right there. If people want to contact me about collaborations or events, there's another link on my link tree where you can send me a message to my email address as well. So yeah, just check that link and everything's there basically. And if you want like a collection of all of the information about sickle cell treatments and modern therapies and supplements, then that's in the ebook Sickle Cell Treatment Guide. So you can access that via the same link too.
Excellent. Well, thank you so much for coming on the show today. It's been brilliant to talk to you. So thank you very much. It's been very insightful.
Thank you for having me and listening. I really appreciate you taking the time to let me share more about sickle cell with people, so that people can improve their knowledge and people get better care.
Yeah. Okay, so I will be back next Monday, 7 p.m. I will have Dr. Ranj Sagu on the show, who is a GP, also a coach and hypnotherapist. He's going to be talking about the work that he does and also how he uses art as a way to manage stress. So I'll see everyone next week.